Bipolar disorder is characterized by extreme, uncontrollable cycling. Patients swing between the volatile highs of acute mania and debilitating depressive episodes. And when the brain loses this equilibrium, doctors rely on an intervention that snaps it back to center. This anchor is an elemental salt, lithium. Lithium prevents manic and depressive relapses over decades of use. It is also one of the few psychiatric medications with clinical evidence for actively reducing the risk of suicide. Its stabilizing effect is reliable enough that specialists use it as an augmentation strategy, adding it to standard medications to improve the response in treatment-resistant depression. However, administering this element safely requires exact precision. It is a therapy defined by constant adjustment and monitoring. This diagram shows the relationship between drug dosage and safety, illustrating a narrow therapeutic index. Notice the incredibly thin gap between the dosage required to help a patient and the dosage where the drug becomes toxic. Prescribing lithium is a biological tightrope. This intervention only works if the patient's internal chemistry is kept in absolute, unwavering balance. Lithium does not function as a quick sedative. It cannot instantly calm a patient during an active mood episode. This graph compares the onset times of different treatments. During acute mania, doctors must pair lithium with fast-acting antipsychotics or benzodiazepines to manage immediate symptoms, while the lithium concentration gradually builds up in the system. It takes several days to see any clinical improvement, and up to 2 full weeks or more to reach a full stabilizing effect. To understand that delay, we have to look at what the lithium is actually doing inside the brain. Lithium works by entering the cells to modulate intracellular signaling. It alters second messenger pathways, the internal relay chain cells use to process signals, which eventually stabilizes the firing of neurotransmitter circuits. The stabilization takes time because the medication is physically rebuilding the structural foundation of the brain's mood circuits. To maintain that foundation, the focus shifts from the brain to the kidneys. Lithium is renally excreted, meaning it relies entirely on the body's plumbing to be cleared from the blood. This gauge represents the concentration of lithium in the blood. For the mood circuits to remain protected, the level must stay within this thin green zone. If a patient becomes dehydrated due to fever, vomiting, or low water intake, the lithium in the blood concentrates and the needle spikes into the toxicity zone. This creates a strict lifestyle requirement, consistent daily fluid and sodium intake. Maintaining these levels keeps the clearance rate stable. Everyday NSAID painkillers, like ibuprofen, can block this clearance. When the exit pipe is blocked, the internal pressure builds and the lithium level creeps back toward danger. Common blood pressure medications, including ACE inhibitors, ARBs like Ramipril, and thiazide diuretics, trigger this same dangerous backup. Furthermore, combining sedatives with lithium creates an additive effect on the central nervous system, increasing the overall danger to the patient. Because of how the kidneys handle this salt, everything a patient consumes, from the glass of water to an over-the-counter headache pill, can turn a life-saving shield into a toxin. This flowchart outlines the schedule required for clinical care. The extensive list of drug interactions and the narrow safety margin necessitate heavy monitoring. Patients must provide regular blood samples to ensure the drug remains within the therapeutic window. Long-term use requires routine laboratory checks on both kidney function and thyroid health to catch systemic side effects early. The golden rule of management is that every new medication must be vetted against this delicate biological math. Lithium therapy is a disciplined, lifelong partnership between patient, biology, and physician. It remains the strongest evidence-backed shield against the volatility of bipolar disorder.